Hello and welcome back to this channel where we talk about the basics of medical information. It's early in the morning here, trying to enjoy the benefits of nature, that is natural air and the rains. In the past few days, it has been raining and we thank God for that. Have you ever been embarrassed by bad breath? Many people have got a natural condition of which sometimes you find that people are chewing gums, using mouth gargles or mouth rinses to get rid of this bad breath. Welcome to this channel. My name is Rebecca Morangi, and kindly, if it's your first time, consider to subscribe. Hit the notification bell so that each and every time when I upload a video, you'll be among the first ones to get notified. Have you ever been embarrassed again by this bad breath? We have what we call morning breath. How does it come about? There is a condition we call halitosis. How does it come about? Sometimes this bad breath can be caused by many factors. Halitosis or bad breath, it's very common in many people. Why do I say this? Because this condition sometimes can be caused by what we take. So that is why I'm saying it affects many people. Many of us, we have in one way or the other gone through it. What are the causes? Many times you find people chewing gums, using mouth gargles, mouth rinses to get rid of this bad breath or to kill the bacteria. But this one is a temporal thing. It's short term because it doesn't address the root cause. When you address the root cause, you will be able to get good results. This video will contain two sections. If you are okay with the first section, well and good. And the second part also will care to explain a bit. What are the causes of halitosis? One is what we call food. Another common cause is what we call smoking and alcohol consumption. We have what we call poor oral hygiene. We have medications. We have what we call infections in your mouth, a dry mouth, nose, and throat infection, and other causes. Those are some of the causes of this condition. If we can explain a bit, foods. Some foods like garlic, onions, and some spices contain a sulfurous compound or sulfur-based chemicals. When we take them, they're digested, they get into the bloodstream. Now, when they are, most of the time, they are exhaled through the lungs. This is the cause of what we call the bad breath. The sulfur-based compound in these foods, onions, garlic, and other spices, They are the one which lead to this bad breath. When you take them, they are digested, they enter into the bloodstream. When they are exhaled through the lungs, they cause this bad breath. Even if you use a freshener or mouth rinses, sometimes they does not help. Another cause we mentioned is what we call smoking and alcohol consumption. This actually sometimes they cause gum diseases. And if you have come across somebody who smokes or takes alcohol and you try to talk directly, when you stand close to that person, you can be able to get this bad odor. So this is the cause of this condition. But mouth gargles can do you good if you use them. And developing a oral hygiene of brushing your teeth thoroughly each and every day, it can really help. We mentioned of poor oral hygiene. Poor oral hygiene means some people don't brush their teeth, especially immediately after eating. And also, it's good to do what we call dental floss, or making sure that food particles which stick or get stuck in between your teeth, they are removed each and every time you eat. This one can really help to get rid of this bad breath. The food particles actually which get stuck in between your teeth can lead to gum diseases, what we call gingivitis. This is the first stage of gum disease. And when it gets worse, it to what we call periodontitis, which is the last stage of gum disease. Actually, it's a chronic inflammation of the gum, where you get that the tissues holding and the bones holding your teeth get infected because of the plague which is formed by these food particles which stick on your teeth. If you have ever seen a person, when you look at the gums, they have what we call a colorless stick bacteria. So when you don't brush your teeth, or you do what we call dental floss, you will be able to get these infections, what we call gingivitis and periodontitis. So it's good to practice this habit of cleaning your teeth each and every time you eat, to get rid of the bacteria which produce this bad odor. And also remember to brush your tongue. Many a time we brush our teeth, we forget to brush the tongue. Also remember to see a dentist regularly so that you can get rid of this. What about the dry mouth? Dry mouth, actually, saliva helps to clean your mouth by removing the particles that cause bad odor. Dry mouth actually occurs naturally during sleep at night, and leading to what we call morning breath, the bad breath which comes early in the morning before you brush your teeth. And this one happens to almost everybody, especially those people. It gets worse when you sleep while your mouth is open. There are some people who sleep while their mouth is wide open. This worsens the condition because there is no saliva. The saliva gets dry. And remember we said saliva helps to clean your mouth by removing the particles that cause bad odor. So remember, the salivary glands are the one which produce saliva. So sometimes this condition can be caused when there is a problem with the salivary glands or the saliva producing glands. This one you can get rid of it actually by drinking plenty of water. Water is good. Water is life. So it's good to have a bottle with you when during daytime you be taking at intervals to get rid of this condition. What about medications? Some medicines have what you call a bad aftertaste. An example of what we call hematinics, all blood builders. Some of them, when you take them, they have this aftertaste which is not friendly. And also when these medications, many of the medications, when they are being broken down, they release chemicals which lead to this bad breath. What of mouth, nose, and throat infections? We have small stones that form the tonsils. Actually, these, we call them tonsil stones or tonsillitis. They are mostly covered by a bacteria which cause bad breath. Many times when you try to examine or when you go to see a doctor, and then if you have a child, even an adult, and then the doctor tells you to open your mouth, actually most of the time you get bad breath coming out. It's because of these tonsil stones which are covered by the bacteria. We have what we call postnasal drip. This is a fluid from your nose that runs down back of your throat. I don't know whether you have ever experienced this. It has a bad breath also. There are some people who have constant swelling in their nose. We have what we call sinuses all on their throat. Have infections of the throat. So this contributes a lot to this bad breath. I believe you are enjoying the benefits of nature by looking at the vegetables around. You have bananas there, you have sugar cane there, you have, I don't know how you call these are pumpkin leaves. You can see them. You can see terere, beans, and maize. Oh yes, so mouth, nose, and throat infections can lead to bad breath. What of infections of your mouth? Surgical procedures. When you get your teeth or tooth being removed, it leads to bad breath. There is some surgeries all when your tooth is being extracted. Sometimes they do some sutures. Those are some of the mouth infections which lead to this bad breath. We have tooth decay, a very good example of this bad breath. Gum diseases and mouth sores. Some of these are the ones which contribute to bad breath. You have other causes like metabolism. When food is being broken down, this one you can, when you are sleeping at night, mostly digestion takes place. That is why in the morning, actually when you wake up, you experience this breath. So when metabolism is going on, it leads to this bad breath. We have GERD or heartburn. This one We mentioned about it in the previous video, gastroesophageal reflux disease. This one leads to this condition also. Also, we have some foreign particles which are stuck in the nostrils, especially in young children. When children are playing, sometimes they can put even the seeds in their nostrils. And if you're not keen, you may not even see them unless when it makes them uncomfortable and they start crying. These ones contribute to bad breath. How then can we treat this condition? This condition sometimes when you go to see a dentist, when you have infections like periodontitis, gingivitis, you have a problem with your tooth which needs to be extracted, you can get help. Sometimes they prescribe mouth gargles or medicated toothpaste which get rid of these bacteria. So regular visits to see a dentist and practicing oral hygiene will really help. Let us see some of the lifestyle modifications you can do in order to get rid of this condition. This one, you can actually get rid of it when you practice the lifestyle modifications. Lifestyle modification number 1 is brush your teeth each and every time you finish eating, at least twice a day. If you can't do it after every meal, do it twice a day. Do what we call floss at least once a day. Remove food particles, all plague, which get trapped in between your teeth, which the toothbrush cannot remove. Very important. Brush your tongue. All use what we call tongue scraper. This will help because the overgrowth of bacteria which covers your tongue, if you don't remove these bacteria, they will bring a problem. Especially those who smoke and take alcohol, and also the condition of dry mouth. Bacteria take advantage of this. So make sure you brush your tongue thoroughly. Don't forget. Clean those who use bridges and dentures. I believe you know this for those who have gone to visit dentists. Some people have got, maybe they have lost some teeth. They have some teeth missing. So they use these dentures. So make sure you clean them at least once a day or as directed by your dentist. Keep your mouth moist. It means stay away from bacteria. Those bacteria, especially those who smoke or use tobacco. Make sure you drink plenty of water, and also don't take too much of caffeine. Caffeine, remember we did a video, we mentioned you can get caffeine in soda, tea, and cola, maybe sodas. So stay away from caffeine and also avoid spicy food. These ones, they're not good. So keep your mouth moist. Remember to chew gum or suck a candy, preferably which are sugarless, because a lot of sugar also contributes to this bad breath. Another thing you can do to get rid of this is you change your diet. How? Stay away from foods. But I don't know how you can do this. How can you avoid onions? It's tricky. And garlic, they're very good spices actually. So If you don't want this bad breath, that is a personal choice, lifestyle. He said it's a lifestyle modification. You're not being forced. So you can avoid that and avoid a lot of sugar foods. They are linked actually to bad breath. Also, do what you call replacing your toothbrush. I believe we have been told this severally by our dentists. Toothbrush, for me, I know you are supposed to replace it after every 3 months, 3 to 4 months. That is what I know medically. So it's good to change them. When your toothbrush is frayed, it's not that straight, it's not sharp. So when you use it, actually it does not even perform its function by removing the plaque which has been formed in your gums, or it does not remove the bacteria which cover your tongue. So use always a soft brush or toothbrush to brush your teeth, because if you use a hard one again, it can harm your gums. Halitosis, up to this level, I say it can happen to anyone. And some people have this condition and they don't know whether they have it, because there are those who are born naturally. Even if they brush, even if they use these mouth gargles or mouth rinses, mouth washes, they don't really work. But if we try these lifestyle modifications, we can be able to minimize this. We should make our health a priority by doing what we can to make our lives better. Thank you so much. I believe up to this level, you have heard what causes halitosis. We started from the causes, and then we explained a bit on the causes, how does it come about, and then lastly we have looked at how we can get rid of this by lifestyle modifications. Let's practice. These basics can go along helping us, helping our loved ones. Let's continue sharing. Share the link. By sharing, it means you are considerate. Thank you so much. I believe my background was encouraging today because it's a bit different from the other videos we have been doing. It's very refreshing when we get this morning breeze, natural air, and the weather also. It's very encouraging. Thank you so much, and let's meet in the next video.